some of my colleagues on the other side want to balance the budget by going after programs that affect our retirees and in particular our seniors. We talk about cuts to Medicare or Social Security. These are long-term benefits that people have worked hard for over the years, have been promised, and I think it's unconscionable that in a time when people are coming into the time where they're going to need those programs that they have believed would be there, that those programs could potentially be at risk because of the cuts that my Republican colleagues are trying to push through. In particular, the issue of trying to privatize Medicare. The plan there is to try to create a voucher type program whereby seniors in 2020 would be given a voucher, and they would basically go out and purchase their insurance in the private market, and where there's a difference between what they would what the plan would cost and what they're receiving a voucher, seniors would have to make up that cost. And starting about 2020, when the program would go into effect, it would cost about an extra $6,400 for each senior to make up that gap. It's just not possible for many seniors to even think about doing that. Let's face it, Medicare was created because the private market failed to meet the needs of our seniors, provide an affordable plan for their health care that they could obtain in the private market. So they just want to take us back to square one, and that's I believe that's wrong. So obviously don't support it. And now what I do support, and I'm not saying that I don't have a plan. We don't have a plan as a counter alternative, and which is what we've done, quite frankly, in the healthcare reform bill that we passed. The healthcare reform bill is going to make changes to Medicare, bringing a lot of efficiencies to the system, including changing it from a fee-for-service, where it's we reward based on the number of tests that providers would do, to instead changing it to a system that ensures quality of care and invests a lot of money into an effort into preventative services.